Jaca Architects is a firm that's been in existence for nearly 25 years now.
Wow.
And we are a firm that specializes in healthcare design. And we have concentrated on healthcare for as long as the business has been in existence.
And, did you start the business yourself?
I did.
And what precipitated that?
Necessity.
You had to pay a mortgage.
I had to pay a mortgage and support 4 children, yes.
Right.
And back in the early 90s, I'm sure some of us in this room remember, but back in the early 90s, when the economy wasn't so good, I was one of those people that found myself in the unfortunate side of the economy. So I ended up deciding that maybe it was a time to hang up my shingle, as they say. And when I did it, I never expected it to be what it is today. I thought it would just be a one-man show for years to come, and it's grown into what it is now. Today we're a firm that is approximately about 30 people,
Mm-hmm.
and we've done healthcare design throughout New England. And
Yeah, not that there is an easy business, because I really have never seen an easy business. And I know it's tough to be in professional services, and you're in a transaction business, so that's always tougher as well. It's not an annuity business. But, you've been in business a long time, 30 employees. What makes you what's the special sauce that keeps you going?
I like to think that it's what we bring to the client, what we bring to the end users as well. And the end users there's 2 groups of end users. There's the client, which is the end user, and there's also the patients, which are the end user. And there's nothing more satisfying when you're done with a project and it's being used and occupied by patients, and it's being occupied and used by staff. When they come back and they say, this really works for us. People are very pleased with the way it's functioning. People are very pleased with the way they get to use the space and the environment around it, and what it means to them for the healing environment. That's what it's all about. It's about the healing environment and the patient itself and how the patient feels. When you have a healthcare issue as a patient, you're very concerned, you have a lot of things in your mind, and you're very anxious about what's going to happen. And one of the least things that you want to be hampered with is an environmental issue where you walk in and you're confused, you're lost, you're not sure what to do, and you want to be comforted as you walk into a space.
Now, before you started the